Rashes can be a bother, but when you find them down there, they can be downright terrifying. Because skin is super sensitive in the genital area, it makes you more vulnerable to possible irritations and outbreaks, most of them being perfectly harmless. Here are a few of the most common conditions. You've heard of Jock Itch before, but other than it being caused by a sweaty athletic cup, what do you really know about it? Here's the deal. Jock itch is a fungal infection that produces a red, itchy, ring-shaped rash in your inner thighs, genitals, and buttocks. It is most common in overweight people or those who sweat a lot, but things like too tight underwear, poor hygiene, and sharing items like towels and razors increase your chance of getting the itch. Treatment is fairly easy. Look for an over-the-counter antifungal medication containing either azoles or alamines, which are both important compounds that inhibit fungal growth. If you have what looks like little red pimples, it could be a case of folliculitis, or infection of individual hair follicles. Shaving, rubbing, and chafing of clothes can instigate the inflammation. Hot, wet compresses can be used to help open the follicles back up. Your doctor may recommend antibiotics or antifungal medications to help control the infection. Yeast infections, also called candidiasis, are commonly associated with women, but guys can get them too. Uncircumcised men and people with diabetes seem to be most at risk. Usually it forms a red, scaly, or itchy rash on the underside of the penis. Because the infection can be shared between partners, treatment works best when both people are actively nursing their respective infections. Your doctor will likely prescribe an antifungal cream to clear it up. And finally, we can't get away without mentioning genital warts. This is the most common STD in the United States. Caused by the exchange of the human papillomavirus, or HPV, this infection shows up as clusters of flesh-colored or cauliflower-like bumps on the tip or shaft of the penis and scrotum. Some warts will eventually go away without treatment, but in many cases, a prescription cream may be needed to help kill the wart tissue. No matter what type of rash you think you have, it's always a good idea to visit your doctor to get it checked out. For more on treating common skin issues, see the rest of the videos in this series.